trying to figure out what's causing asthma, allergies, or problems to food, we have skin testing and blood testing as two options to answer the question. So starting with skin testing, we take a drop of the allergen and put a small prick of the skin that's relatively painless. And if you are allergic to that substance, after 15 minutes, you'll develop a mosquito bite bump, and it's a little itchy, but it's quickly relieved with medication. Now, the alternative is a blood test. This is just like any blood test you'd get. It's a blood sample that comes back in a few days, and it will tell you if your body's making something called IgE to that allergen. Now, in comparing to the two, skin testing is much convenient for patients because you get the answer right there. We can counsel you about it. And the only downside of skin testing is that you do have to stop allergy medicines 7 days prior, as well as the fact that it is a little itchy. Now, blood testing doesn't require you to hold allergy medicines, so you continue your medicines. And blood testing is also very interesting because there are certain components or pieces of the allergen we can test that is not available by skin testing. Unfortunately, blood testing may be a little bit more expensive, and of course, you do have to have that second conversation outside the office. Both are great options and are very accurate for all of our patients.
How can blood testing help identify allergic triggers? Let's take a look. A specific IgE blood test is a powerful tool that can help your healthcare provider make an accurate allergy diagnosis. It can be performed regardless of your age, skin condition, or current medication. Unlike skin prick testing, a blood test carries no risk of triggering an allergic reaction. A single blood draw provides reliable results you can trust. Along with your patient history, symptoms, and physical examination, the results of this blood test can help your healthcare provider identify allergic triggers, reduce exposure, and minimize symptoms. The immuno-CAP IgE-specific test is a sandwich-type fluorescent enzyme immunoassay, FEIA, and is the most widely used blood-specific IgE assay to aid in the diagnosis of IgE-mediated allergic disorders. The solid phase used in the immuno-CAP reaction vessel is a hydrophilic, highly branched cellulose polymer in 3 dimensions. Allergens are covalently immobilized on this solid cellulose phase, allowing their original 3-dimensional structure to be maintained. When the Phadia instrument adds the serum or plasma sample to the reaction vessel, allergen-specific antibodies present in the sample bind to the immobilized allergens. After removing non-specific antibodies by a washing process, the instrument adds enzyme-labeled antibodies against IgE, thus forming an antigen-antibody complex. After incubation and further washing, the Phadia instrument adds a developing agent, which is converted into fluorogenic molecules by the action of the enzyme. Once the enzymatic reaction has stopped, the fluorogenic solution is placed in the immuno-CAP reaction vessel. Finally, the Phadia instrument measures the fluorescence of the solution and, using its software, calculates the concentration of allergen-specific IgE using a calibration curve.